Hello and welcome. Today I have for you a special guest, Dr. Arthur Evans, who we consider one of our local legends. Dr. Evans is a clinical and community psychologist and healthcare innovator. He is currently the CEO of the American Psychological Association, which is a professional organization representing psychology in the United States. With more than 146,000 researchers, educators, clinicians, consultants, and students as members, APA promotes and disseminates psychological knowledge to benefit society and improve lives, which is a mission that is consistent with Dr. Evans' work. Dr. Evans has also served as the Deputy Commissioner for a Behavioral Health System in Connecticut and Commissioner of the Department of Behavioral Health and Intellectual Disability Services in Philadelphia. So, Dr. Evans, welcome and thank you so much for being my local legend.
Yeah, thank you. I'm really delighted to be here.
So, can you start off by telling us what drew you to the social services field?
Well, I think, I grew up in the 60s and the 70s in Florida, and I like to describe my experience as a child as seeing two worlds simultaneously. My father was in the military, and so in one sense, now you have to think about what was happening in the 60s and 70s in the country. I actually went to segregated schools for the first 6 years, first 2, 3 years
Oh,
of
wow.
my education. So segregation was still happening. It was a civil rights movement. There were a lot of protests. So I saw that on the one hand, but then I lived in an integrated world in terms of my dad being in the military, living initially on military bases. And so that juxtaposition of seeing
Mm.
what's possible and what the reality was for many people really kind of created a desire in me to use human service and really being a psychologist as a way of creating more equity and justice in the world. And even though I didn't lead with that during my career, that's essentially what I was doing. I was really trying to create a more equitable world using my degree and training as a psychologist.
So that's really interesting that you have that lived experience, and that's not too long ago, right? And that, most of the time folks think about, and in particularly, uh, I'd say Gen X and younger, think about that as a time that happened a long time ago, right?
Mhm.
Segregation. And so I think that it's really interesting that you have that lens and can bring equity to your work. Can you talk a little bit about perhaps an accomplishment that you're really proud of and why? And also, if you have anything related to that equity work, I'd love to hear if there's anything like that you could share with us.
Oh, sure. Actually, my work in Philadelphia, I think I'm extremely proud about because, that was work that we did together. The thing that I've always prided myself on as a leader is that it's a team sport, right? So it's not about my individual performance. Yeah,
Mhm.
there are things that we want to excel in as a person, as a professional. But at the end of the day, what we do is a team sport. And what I pride myself on is being able to put together a great team of people, which I was able to do in Philadelphia. Hopefully, to be the kind of leader that can motivate people and to inspire people to think differently and creatively. And I think we did that in Philadelphia. When I came to the city leaders really wanted behavioral health to evolve and to really focus on how it could be more impactful for people in the city. And I had this great opportunity to build on a phenomenal infrastructure that had been built before I got to the city. So the way the services are financed, the way the system is
Mhm.
structured, is just really unmatched in the country, really. And if you think about that, most people don't recognize that. And so I really had an opportunity to just come in and focus more on how are we going to treat people differently. And
Mhm.
initially, a lot of that work was on moving to a recovery orientation for mental
Mhm.
health and substance use. And that simply means thinking differently about what our goals and our outcomes are. So, for most of us who are trained as clinicians, we think about our role as being eliminating the symptoms that people may be having. So, if I'm depressed, and I have these symptoms of depression or psychosis or anxiety, that my goal is to help the person in terms of eliminating those symptoms. But what
Mhm.
recovery says is that's only a means to an end. The real end that we're looking for is for people to have the kind of life that they want to have in the community. And that's what we should be working towards. And so once you make that decision, it has lots of implications in for how you work with people, the kinds of services that you need, the approach that you're going to take, how you train people. And so when we made that decision in Philadelphia that we were going to make recovery and people having the kind of life that they wanted to have as our goal, it really set into place a transformational process that I think probably continues to this day. I've been gone for about 7 years. But if you look at what the system looked like when we started that work, and then what the system looked like 12, 13 years later, when at least when I was exiting, and I think again this work has continued, it was a very different system. People, the language that people used was different.
Yeah.
How people thought about what the services were that we needed to have were different, and that is really because there were so many people in the system that embraced that way of thinking and really joined into that process. And one other thing I'll say about that, our thinking actually evolved from the recovery work to really thinking about population health. And what that simply meant is that we're not just interested in people who have a diagnosis, but we're really interested in the health of the entire community. And so we started really thinking about, yes, there are people who have very serious problems, and we want to help them to recover from that. But we also want to make sure that all those people that may not have a diagnosis, but they're struggling, we want to make sure that those people can do well as well. And we want to make sure that the people who are in the community who are doing well continue to do well. And those are all things that we do when we think about our physical health. You know, we diet, we exercise, not because we're trying to cure something, it's because we want to stay healthy. And in the same way, we recognize that if we want people to stay psychologically healthy, that there's work that we could be doing as a field. And so that transition from really thinking only about symptoms all the way now to thinking about how do we help everyone in the community have the best health that they can, I think was just really phenomenal. I'm just so proud of the people in Philadelphia that contributed to that.
And so I really appreciate that you sort of took us along the journey of symptoms to population health. And that's why I wanted you on this episode to represent, the work that you've done. And you're a local legend to me because of how visionary you are. And so I can tell you absolutely that the work that you started has carried on and has transformed the way people think, to your point, transforms lives, but also transforms the way practitioners approach this work. So, with that thought in mind, can you talk a little bit perhaps about some of the ingredients, being skill sets or strategies that social service professionals must employ to be effective? What would you give as advice to be effective?
Yeah. Well, I think if you're going to be in the social services field, I think you have to have a variety of different skills. I think we lean very heavily on the interpersonal, and that
Mhm.
is absolutely important. You can't do this work without having good
Right.
interpersonal skills. But there are other skills, and I'm trained as a psychologist. So part of my training is being trained in research and data and science.
Mhm.
And what I found in my work throughout my career, psychologist for over 30 years now, is how important having a scientific understanding and background is if you really want to help people. There's a lot of research out there that if you
Mhm.
apply that research, it can make a huge difference in people's lives. And in fact, that one of the things, talking about things I'm proud of in Philadelphia that I was very proud of is that we work with some of the premier people in the world who had created psychosocial interventions and brought those to people in Philadelphia who are basically people who are poor, people who didn't have insurance, people who are on Medicaid. And so actually that's something I'm very proud of is that we could say with certainty that there were people in Philadelphia that got better services than people who had lots of money and were going to clinicians who hadn't worked with an Aaron Beck or Edna Foa or a Judy Coyne. These are people who he created, or Marsha Linehan, who created DBT. So these are people who created premier psychosocial interventions, psychotherapeutic interventions. And we were
Mhm.
able to bring those people to Philadelphia, train clinicians, and then make sure that people in our communities had access to that. And so I think having an appreciation for that, if you're going to be in the social services, is very important, because what we
Mhm.
saw is people who many people had given up on,
Mhm.
people who people thought weren't going to get better, all of a
Mhm.
sudden, because we were bringing in the science, actually got better. So I think that that's a really important piece of it. And then I think for people who are working in social services, having an appreciation for sort of the breadth of needs that people have. So, excuse me, if you're a psychologist,
Mhm.
well, people have other needs. If you're a social worker, people have other needs and the needs that you get trained on. And so your ability to work with people outside of your profession, outside of your domain,
Mhm.
is really
Mhm.
important, because very rarely, particularly if you're talking about people in the public sector, do people come with one specific issue. They usually come
Mhm.
with a whole variety of issues, and you don't have to solve all those issues, but you have to be aware of that, of how to solve those issues, and who can help, who you can bring to the table to help people in those areas.
So I appreciate you talking about employing best practices, right? And to folks that might not normally have received that level of service in the past, and bringing that to folks who are part of the Medicaid population. And then also you touched on how to sort of make sure that when you are serving someone, that you're aware of the other systems that might engage with that person, and that person might need support. And can you talk a little bit about how you think various systems could work better together to serve folks? So I'm thinking academia, you mentioned research, but also health systems and nonprofits. Do you have any recommendations for how silos can work better together?
Sure, sure. Yeah, and I think there's another area where the city of Philadelphia has really excelled. And again, a lot of that work happened before I came to the city. So my predecessors had really established this idea that systems have to work together. And so we were
Mm,
able to build on that work. So if you go to Philadelphia now, at least it was, and I think this is still true, every family court in Philadelphia had a mental health clinician. Every school had
mm,
multiple clinicians. The
mhm,
police
mhm,
department was trained by psychologists and other mental health
mhm,
professionals, and integrated that actually in the academy, as well as once they got out of the academy and they were on the streets, they were getting training from us. People in the faith community were getting
mhm,
trained in mental health first aid. So there was really not a part of the city that first of all, that behavioral health doesn't affect. All of those people that I just named
right.
will tell you that mental health, substance use issues are affecting their work, whether it's the jails,
Mhm,
schools, child welfare, all of those systems, they know that. And so if we're going to solve these problems, we can't have this mental model, which I call the black box model, where we create a black box called treatment, people get sick, and we expect people to come to us. First of all, understand what box to come to, and
mhm,
go through the right box, have the wherewithal to get there, not have any stigma associated with getting there. That is a lot to ask of people who are struggling with very serious issues. And so if we want to get to those people, what we have to do is we have to go to the places where they are, and
mhm,
embed services in the places where people are. And so that's why the cross systems work is so important, is because we're meeting people where they are. If they walk through the criminal justice door and they have a problem, we want to have services there. If they're in school, we want services there. And so being able to talk to people in other systems, understand their language, understand
mhm,
how
mhm,
they understand problems, is very important. And one last thing that I would say that I found to be really important, we could go to those other systems and say, hey, mental health is really important. You guys ought to pay more attention to that.
mhm,
Or we could go to those other systems and say, well, we know that people with mental health challenges are a real challenge for you. We think we can help you solve that problem that you're having.
mhm,
So why
mhm,
don't we form a partnership? So what that means is that if we approach other people by saying, we're here to help you solve a problem that you have, it makes those partnerships much stronger, and it gives you insights into how you need to modify what you're doing so that you can be maximally effective in that cross systems work.
Yeah, I think that to position as helping to solve a problem of another system is a brilliant approach. And I think uniquely about behavioral health, it does undergird so many other systems, um, unlike other challenges that we might want to address for folks. And so that, as well as meeting people where they are, I think is so very important. I think that over time we have learned that we need to do that. But I think it's also trauma informed. I think it's also more compassionate and valuing people to meet them where they are and understanding that these systems are hard to navigate. And so when we can do things to make those resources available, those necessary interventions available for folks, I think that we are doing our best work when we can meet people where they are. If you could wave a magic wand and have any resource in an unlimited supply to help and serve people, what would that be and why?
Hope,
Mm,
because at the end of the day, what keeps people going is having hope. And I think, I
mhm,
look back at the work in Philadelphia, what we were able to do is to work with people who had lost hope because they were living on the streets for 13, 14 years, didn't believe they could ever get off the streets, or people who had very serious mental illnesses. We had people who were in inpatient settings for over a year. And because we
mm,
brought in evidence-based practices, we could cut their time in that inpatient unit in half and reduce all kinds of issues that they were experiencing and get them connected to the to resources in the community. We could help people who were in churches. I mean, one of the things we did in Philadelphia was really work very hard with the faith community, because we know that many people, they will go to their pastor, their imam, or their rabbi way before they'll come to a psychologist or someone else. And so we really helped those individuals better recognize when people were having challenges, understand how they could get people connected to services. And I think that also gave hope to people who may not have ever walked to when in one of our doors. And so I think that that's the important ingredient that makes all the difference in whether people are going to get well or not.
I love that. And I was sitting here waiting for an answer like housing or like, I don't know, more, a particular type of resource need. But I think to the point you're making, that's why you're visionary. People having hope by all means is something that helps to change their lives when they are given that. And then also when we provide an opportunity to show people that they are valued and cared for and help to reinforce that hope, I think that's so important. What words of wisdom would you have for all of us that are in the thick of our careers to be impactful?
I think it is to not be discouraged, because one of the things that happens if you do hard work, and I know, Katrina,
Mhm,
you did hard work, you still do hard work, but you're working with people who were unhoused, people who are living on the streets, people didn't have housing. And that work, if you do that work year after year, day after day, at some point you can become demoralized because it feels like you're not making progress.
yeah.
And one of the things that I saw in my work, again, especially in Philadelphia, I saw this in Connecticut when I was there as well, is that at some point people don't necessarily get jaded, although some people do get jaded. But you start to lose that sparkle that you have in your eye when you first come into the field,
Mhm,
and you think you
mhm,
can help everyone, and you think you can
right.
make the world a different place. And what I believe is that we actually can, if we work differently, if we are willing to get outside of our comfort zone and maybe talk to that researcher, or get out of our comfort zone and maybe talk to that person in that other system that you may not agree with. Well, I have a problem with medication assisted treatment because that isn't that just substituting one drug with another. No, that's
Mhm,
helping people just like cancer medications help other people. So if you're willing to go beyond your boundaries and you can bring in new resources, new way of looking at problems, it can really help to reconnect you to why you came into the field and
Mhm.
to begin with. One of my most satisfying things that I experienced when I was commissioner was when people would come up to me and say, and this actually happened several times when I was commissioner, I was getting ready to retire,
Mm.
and you all came in and you trained us on CBT or TF, the trauma informed CBT or some technique, and I saw people get better, and I'm now having the most fun that I had in my
Wow.
career. I don't
Yeah.
want to quit. I know multiple people who were about to retire and decided to stay in the field because they started to see people get better, and it reconnected them to why they became a social worker or a psychologist or whatever. And so I would just say, don't give up hope. Look for ways to re-energize you because you are helping people to get better. Because what we do is, I think that what we do is God's work, right? We
Mhm.
help people, many of whom nobody else wants to work with. Those are the people that we work with in our field. And if we can reconnect to why we wanted to do that in the beginning, that is the thing that I think can really help to sustain us and help us to have maximal impact in people's lives.
Thank you. Thank you for that recentering. That's what that feels like to me, and I appreciate that. I think that, all of us coming into this work with, ideas of how we want to be impactful, I think to your point, is very easy to lose sight of that, and to figure out what gives you energy, joy, purpose, and hope, I think is really, really important. So, Dr. Evans, thank you so much. Thank you for being
Yeah,
here.
thank
Thank you for
you.
sharing your wisdom with us. I really appreciate your time. So, thank you.
Thank you. I always appreciate you.
Okay, take care.